A 14-year-old female patient with a postoperative complication of optic nerve pit presenting with an extrafoveal macular hole and associated retinal detachment. We began the procedure with the completion of posterior vitrectomy, followed by careful aspiration of the fluid through the extrafoveal macular hole. We encountered difficulties achieving complete adhesion in the macular area due to persistence of subretinal fluid, a challenge associated with the pathophysiology of the optic nerve pit. We used perfluorocarbon and performed a fluid aggregate change, but noted a rapid accumulation of subretinal fluid, possibly due to pressure gradient difference at the optic nerve pit. We proceeded to introduce a fragment of platelet-rich growth factor membrane and position it in the extrafoveal hole, followed by a second fragment to seal it adequately, and a third fragment to seal the optic nerve pit. Finally, we performed successful fluid aspiration, left intraocular gas, and concluded the surgery. This is the postoperative result showing anatomical and functional stability. The retina is completely attached and the extrafoveal hole is sealed. The correct visual acuity is 20/60. Platelet-rich plasma is a blood derivative that contains several trophic factors and not only facilitates tissue healing but also stimulates tissue regeneration. The technique begins by extracting a blood sample from the patient, which is subsequently centrifuged to separate the blood components, and the second layer of this preparation is taken to later add calcium to activate the platelets and finally incubates it to form the plasma membrane, which is introduced through the trocar after performing the vitrectomy and is positioned over the hole, confirming its location with intraoperative OCT. Optic nerve pit closure can encounter failures and complications due to anatomical and pathophysiological complexity, especially with persistent subretinal fluid. PRGFM offers an effective solution, aiding in healing, defect closure, and improved retinal adhesion.